As we grow older, staying on top of our health becomes more important than ever. Many health conditions that affect seniors can develop quietly, without noticeable symptoms, and by the time they do appear, the damage may already be done. That's why regular health checkups are not just a formality. They're your first line of defense against serious illness. In this video, we'll talk about the top 10 health checkups that seniors should never skip. These tests are recommended by doctors around the world, and they can make the difference between catching a health issue early or missing it until it's too late. Whether you're in your 50s, 60s, 70s, or even older, these checkups are essential. Let's dive in. First on the list is the blood pressure check. You may have heard of high blood pressure being called the silent killer. That's because you can feel perfectly fine and still have dangerously high numbers. High blood pressure puts strain on your heart, your arteries, and even your kidneys. It increases your risk of stroke, heart attack, and other serious conditions. For most seniors, your doctor will want to see your blood pressure below 130/80. A quick check at home or at the clinic can give you peace of mind, or early warning if something's off. Next up, the A1C blood test, which checks for diabetes. This test doesn't just look at your blood sugar in the moment. It measures your average sugar levels over the past 3 months. That means it can catch early warning signs of diabetes before you even feel thirsty, tired, or dizzy. Type 2 diabetes is very common in people over 60, and if left untreated, it can cause problems with your eyes, kidneys, nerves, and heart. But when caught early, it can often be managed with simple changes in diet, exercise, or medication. The third test you should never skip is a cholesterol panel, also called a lipid profile. This measures your total cholesterol, LDL, which is the bad cholesterol, HDL, the good kind, and triglycerides. High LDL cholesterol can lead to buildup in your arteries, restricting blood flow and raising your risk of heart disease and stroke. Doctors often recommend checking cholesterol every 4 to 6 years. But if you already have risk factors like diabetes or high blood pressure, you may need it more often. Knowing your numbers helps you make smarter decisions about food, lifestyle, and medication. Our fourth checkup is one many people avoid, the colon cancer screening. But here's the truth. Colon cancer is one of the most preventable types of cancer. It usually starts with small polyps in the colon that don't cause any symptoms at all. A colonoscopy can find and remove these polyps before they become cancerous. If you're 50 or older, your doctor may recommend a colonoscopy every 10 years, or other tests like a fecal occult blood test or FIT test more frequently. Yes, the prep can be a hassle, but the peace of mind is worth it. The fifth test is a bone density scan, often called a DEXA scan. This test checks for osteoporosis, a condition that weakens your bones and makes them more likely to break. Unfortunately, many seniors don't realize they have osteoporosis until they fall and fracture a hip or spine. That's why it's important to check your bone health, especially for women over 65 and men over 70. If you've had previous fractures or are on medications that affect bones, you may need testing earlier. Number 6 is an eye exam. Vision changes are common as we age, but they shouldn't be ignored. Seniors are more prone to eye conditions like cataracts, glaucoma, and macular degeneration, all of which can cause permanent vision loss if not caught early. A full eye exam from an optometrist or ophthalmologist every 1 to 2 years can help detect these problems before your sight is permanently damaged. It's not just about seeing clearly. Your eyes can reveal clues about diabetes, high blood pressure, and more. 7th on our list is a hearing test. Hearing loss might seem like a small inconvenience, but it can have a big impact on your life. Struggling to hear conversations can lead to frustration, social isolation, and even cognitive decline. In fact, recent studies show a strong connection between hearing loss and dementia. Getting your hearing tested is simple and painless. And if you do need a hearing aid, today's options are more effective and discreet than ever. Our 8th checkup is a skin exam. Skin cancer is the most common cancer in the world, and older adults are especially at risk due to years of sun exposure. Melanoma, the most dangerous type of skin cancer, can spread quickly if not treated early. You should have a dermatologist do a full-body skin exam at least once a year. In the meantime, keep an eye out for any new moles, spots that itch or bleed, or changes in existing marks. When it comes to your skin, early detection is everything. 9th is a cognitive screening. Occasional forgetfulness is normal, especially with age. But if you or your loved ones notice changes in memory, reasoning, or language, it's worth getting checked. A cognitive screening test helps identify early signs of Alzheimer's disease or other forms of dementia. Early diagnosis means earlier access to treatment, support, and planning, which can make a big difference in quality of life. 10th, let's talk about immunizations. Many people think vaccines are only for children, but they're critical in later life too. As we age, our immune system becomes weaker, and infections can hit harder. Seniors should get an annual flu shot, a shingles vaccine, pneumonia vaccines, and stay updated on their tetanus booster every 10 years. These vaccines protect against serious complications and hospital stays, and can save lives. And here's one more important step that doesn't always get mentioned: a medication review. Many seniors take multiple medications, and over time, these can interact in ways that aren't safe. Some medicines can raise blood pressure, affect memory, or cause dizziness and falls. Once a year, or any time there's a change in your prescriptions, ask your doctor or pharmacist to review all the medicines and supplements you take. It's a simple step that can prevent dangerous side effects. So let's quickly go over the list again. 1. Blood pressure check. 2. A1C test for blood sugar. 3. Cholesterol panel. 4. Colon cancer screening. 5. Bone density scan. 6. Eye exam. 7. Hearing test. 8. Skin check. 9. Cognitive screening. 10. Immunizations. Bonus: medication review. These checkups don't take much time, but they can protect your health, your independence, and your peace of mind. Remember, the goal is not just to live longer, it's to live well. Stay ahead of problems before they start. Prevention is always better than cure. If this video helped you, consider subscribing for more senior health tips. And if you know someone over 50 who needs a reminder, share this video with them. Because staying healthy isn't luck, it's a habit. Thanks for watching, and here's to your health and happiness.